Hello, good afternoon. We are back on with another ARPA talk. And again, I am Donna Mitchell with Aging Advantage. And today we have another speaker who's going to be sharing some education with us, something I'm sure most of us either will be able to most definitely appreciate for ourselves or for someone else that we know. And through the ARPA Talk, these are local grants and donations that offer programs to help with the effects of COVID and other post-pandemic situations, like that food and housing insecurity or isolation. Through these partnerships, we provide educational topics that can help promote self-care and resilience. And again, we're going to have Susan Gallagher here to talk about diabetes. And once she's finished, we can, if you have any questions, comments, concerns, we'll come back on and address those. But for the time being, we're going to give Susan our attention, and the floor is yours, Susan.
Thanks so much, Donna, and good afternoon, everyone. And again, thank you to yourself, Donna, and to Lee for the opportunity to be part of this speaker series. My name is Susan Gallagher, and I am happy to be with you today to be discussing demystifying diabetes 101. And today we're going to talk about some navigating community-based uh, navigating of community-based education and resources in order to strengthen diabetes self-management. So thank you again to Aging Advantage for being an educational partner here. And so let me start off just by taking a moment or so to tell the audience a little bit about myself. I am a licensed and credentialed registered nurse, and my experience is mainly been in hospital-based long-term care and also academic nursing positions. So I am a trained nurse educator by background and also at heart. And so when Donna and I started this conversation about potential topics, and she mentioned diabetes, I was actually very enthusiastic and very kind of excited about that on a few different levels. So one, as Donna has already mentioned briefly, diabetes affects many individuals in the community, especially the community-based populations. For those that have what we call pre-diabetes, or basically who haven't formally been diagnosed yet. So it's a very broad scope topic. Secondly, on a personal level, I've had some family members affected by diabetes. And so, thirdly, it is because of all the reasons that we've briefly mentioned, it is also very much considered a chronic illness. And so, chronic illness management from that standpoint becomes very important then in the community. Uh, Fourthly, facilitating positive health behaviors and well-being to improve health outcomes is an identified 2025 patient standard of care. And so I think that is very relevant to diabetes, health behavior, as well as improving health outcomes. And uh, additionally, diabetes becomes more prevalent the longer we age, and so it becomes more prevalent in the older adult population. My focus is on seniors and senior related care, and so being a nurse who's worked in long-term care, there is a lot of prevalence of diabetes and management of diabetes that happens in that older adult population. So what are we really um, discussing, that's relevant to strengthening those community-based resources and to self-management. And so we're going to start with the basics of the basics. So pre-diabetes versus diabetes 1 and diabetes 2. So pre-diabetes is, again, prior to diagnosis, although pre-diabetes can exist for several years without diagnosis and just becomes that much more serious, unfortunately, once a diagnosis is made. Very similar to heart disease, and there is also a very strong connection between diabetes and heart disease. Similar to that, it can be very silent and otherwise with prediabetes. And so it's kind of important to know that distinction, or I guess that borderline. Um, so type 1 is generally speaking insulin dependent. And so, I've had friends even going back to when I was in college who were diagnosed as children or diagnosed at a very, very young age. I've also had children of friends my own age whose kids were diagnosed at a very young age. And so these are more long-term situation, insulin dependent situations again. And these may be individuals who, if they're young enough at the time, even become, good candidates for things like insulin pumps and whatnot. Diabetes type 2 is definitely a later, generally speaking, a later onset diagnosis. So, which is considered non-insulin dependent. And so, at least at the beginning. Now, the other important distinction, or I guess, borderline, is when a type 2 diabetic kind of formally over time, or finally, I guess, more or less converts to insulin dependence. Even if it's short acting, there is that link as well for even that type 2 person. And it doesn't always happen. It doesn't always mean that it's going to happen or end that way, but there is, that connection. So, what are some of the common signs and symptoms? So, it's kind of, the classic frequent urination. Oftentimes, you'll see frequent thirst or increased frequency in thirst. It can take the form of extreme fatigue. It can sometimes take the form of a complication that's common that the person doesn't even realize is necessarily linked to diabetes. So, those are kind of some of the common factors. I mean, what are some of the risk factors that kind of go along with some of the signs and symptoms? Would be things like increased weight, increased age, depending on how your sugar levels have done across the lifespan while you were younger, and another risk factor would be exercise, frequency of exercise, or unfortunately, kind of lack thereof. And I am guilty of it too, to a certain extent. In terms of walking more and being more diligent about that. Kind of one of the things that I guess I struggle with is there are certain things that we should be doing every day, right? Like diet and exercise, and tracking your sleep and tracking your water and tracking positive health behaviors and meaningful things, and an adequate amount of rest and relaxation and those kinds of things. So and those are all very meaningful, all worthwhile. Obviously it is, I struggle like everybody else with, making that happen always on a daily basis. And so, exercise is also a risk factor for not being able to um, decrease those glucose levels like we would potentially like. So, what are some of the long-term complications? I mentioned that there are, excuse me, links between diabetes and heart disease, for example, and an increased risk for stroke. So, personally, I mentioned at the top of the presentation that I've had family members um, who have had issues with diabetes and diabetes management. So uh, I have had a grandmother who has since passed on several years ago, but who was an insulin dependent diabetic who not only had heart disease, but who had what we think was probably a more what wound up being more of a vascular related type of dementia, at that time. Um, she did not necessarily have a stroke per se formally, although, a person can have TIAs and transischemic attacks and not necessarily realize that those are always happening when they are happening. So, and that also can be a contributor to issues with vascular disease and dementia. So, um, I had another family member who did end up, unfortunately, having a stroke and was not diagnosed with type 2 until that actually happened. And so, even in primary care settings, I've heard doctors talk about the fact that, if we don't manage this now, you're gonna at some point potentially face a major or significant stroke type of event. And so obviously we don't want to see it come to that if it can be managed appropriately. So what are some other complications? Things like chronic kidney disease over time, things like neuropathy or you'll hear it referred to as nerve pain over time, as well as things like increased risk for gingivitis. So oral health is not something we hear talked about a lot per se, although it should be talked about more in relationship to overall well-being. And the mouth is the gateway and the gatekeeper kind of to the rest of the body. So, you look at the somebody's oral health status, and it will likely tell you or be able to tell you a lot about what's happening in the rest of their body. So gingivitis, increased risk for infection, increased risk for wound healing if somebody does have increased risk for healing in terms of infection, but also increased risk for wound healing if somebody does have either a surgical wound that is trying to heal, or if they do have some type of chronic diabetic ulcer related type of wound, that they are trying to heal. And unfortunately, a lot of times those end up being or becoming more chronic in nature. And so the more chronic in nature it becomes, the more difficult, obviously, it becomes to heal. So that would be, kind of the classic diabetic foot ulcer that we tend to think of. And what might not be um, a significant issue in someone without diabetes becomes a very significant issue in someone with diabetes. Foot care, in terms of foot care or managing any type of area on your foot that might a diabetic foot that needs attention. So today we are here to learn about some of the recommendations and community-based approaches and resources. So number one, I would say would be know your numbers. And so that can take on many forms these days. So I will also share with you that when I was first in nursing school, that was not as easy to determine as you might think. This was the late 80s, early 90s, when we were still determining blood sugars blood sugar range partly in the form of ketone management or ketone testing. And so, that would give you a range of what the blood sugar might be. And so it was very hard to manage a range in terms of that versus a specific number like we're able to get now. And so from that, over time with the advances of technology, we have been able to not only look at glucose monitoring, but also CGMs, so controlled glucose monitors. So like the Dexcoms, the Libras, of the health world. There's a lot more technologically advanced health monitoring that has made a lot of leeway in helping people with self-care management. So know the numbers. And that is not only blood sugar related, but general vital signs. Blood pressure is also, as we've just discussed, also very important number to keep track of. And given the link between diabetes and cardiovascular disease, that can also be somewhat telling. So if high blood pressure is what kind of happens first, then controlling that will also help manage some of the risk for some of those long-term complications. Number two, healthy meal plans. So, and I have some resources. I did tell Donna I have some resources that I can share with everyone in terms of a handout with some website information. But healthy meal plans, in terms of not only balance, but proportion size as well. So again, when I was being trained as a nurse and when I was learning about diabetes in nursing school, there was very much a different approach to all of this in the sense that we understood at the time, understood diabetes to be more of a peak and valley type of disease process. So in other words, for example, if somebody's blood sugar was really, really low, we were being actively trained, to treat that with orange juice and sugar and, direct sources of glucose. And so hence the term peak and valley, and then from that valley you would go back up to the peak again partially because of at least treatment. So obviously treating the low blood sugar is a correct response, but there's a lot more of emphasis now on stable blood glucose management across the board, and more of an emphasis now on protein as far as healthy meal plans are concerned for more stable blood sugar levels and blood sugar control. So point number three would be screening for obesity, and that can be done through a primary care doctor's office or a clinic setting on an annual basis. What is your BMI, body mass index? What is your risk in your overall screening in terms of obesity? That is also something to track. I have a conversion calculator that I will, point number four, that I will include on the handout, but using a conversion calculator, again, for carbs again, it's not wrong to count carbohydrates. We're still doing that, but there is an emphasis on not only protein, but portion size. The answer is not to necessarily eliminate carbohydrates altogether. Our body does need, as a whole, carbohydrate to function. Your brain needs carbohydrate to function. But again, it's about balance, and it's about control and portion size as well, in terms of serving. Point number five, for the 4Ms framework for age-friendly health systems. So number one, looking at mentation. What is your overall cognitive, not only cognitive ability to be able to engage in self-management, but also what is your mindset in terms of engaging in self-care management. The second M would be medications. Know your medications and stick with a prescribed medication plan. The third M would be mobility and associated complications. What are your risk factors again for that, and what is your management of mobility? And point number four in the 4Ms is matters. And what we mean by that is what matters most. What are your goals? What matters most to you? What matters most in terms of chronic disease management, self-care and self-management, and what is going to work for you. I guess I would add to that, what are your barriers, if you have any, toward being able to obtain healthy food options, your medications, or your access to supplies and things like that to be able to self-manage your situation. And then point number 6, I believe, is what we're on. Be aware of insurance benefits and the extent of insurance coverage. So if you have private insurance, check things like copays and extent of benefit and benefit coverage, and what that all entails, and frankly, what is a benefit to you that you may or may not be aware of, and what are some of the insurance related things that could be helping you long term. And then finally, reasonable workplace accommodations, and also advocacy issues. So reasonable workplace accommodations in terms of being able to take a meal break when that's needed. If you need a snack break. If your blood sugar is low, for example, inadequate time to just be able to take a few minutes to have a drink and a snack to be and just a couple minutes to sit down to be able to help yourself. There are instances, particularly for me as a nurse that I am aware of, as you can imagine, where we have nurses who are diabetics who work anywhere from an 8 to a 12-hour shift. And so it is, um, really difficult to be able to potentially, manage that for 12 hours when you are, taking care of an assignment of individuals. If you are working in other settings, it could be equally as difficult, to find time to be able to take a break or to be able to um, do your job, frankly, if your blood sugar is off. So I'm seeing we have a couple people that have joined us. Thank you for tuning in. So I guess let me pause for just a second, Donna. Are there any questions up to this point? I'm not sure if anything has come through the chat.
Nothing so far, Susan. You're good.
Okay. All right. So I appreciate that. And so if there are any questions as they come through, please just let me know. If not, and we have questions on a replay, let me know that as well. So what are some resource friendly um, uh, organizations that can help in a situation like this? Well, certainly one is the American Diabetes Association, and they have a lot of good resources available on their website, which I will include in the link. So, for example, Common Terminology Explained. They have a consumer guide resource center, which is also really great. They have a quick guide for insulin, and we haven't really talked about specific related medications a lot to this point, but that is all very well explained on their website. Anything from your oral anti-diabetics up to your insulin, both short acting all the way up to long acting. So what I currently see, and I will also give a little disclaimer that I still work as a nurse per diem. So PRN per diem hours in the clinical area, in the clinical arena, to be able to keep my hand in things. And so in the clinical area, I still see, that whole spectrum of anything from oral anti-diabetics, glipizide, glucophage, Jardians is a new one, up newer one up to your short-acting insulins, which would be Aspart and Lispro, all the way up to your long-actings, which would be your Glargine insulin. And that is intended, again, going back to the point about stability that I made earlier, that is intended to stabilize, long-term stabilize your blood sugar for up to a period of about 24 hours. What we have to be very careful of in a clinical setting as well as in a community setting is when using a long-acting insulin like that, to actually make sure that we're aware of when blood sugar is getting to be too low, and that people can learn those signs and symptoms and feel that, and be able to know at that point to check a blood sugar and just see. I will also say that comparing how you feel to the number, whatever that is very important. And so, even if somebody says, well, I just don't feel off, or all of a sudden we have somebody who's really in the clinical setting, we have somebody who is potentially really off or really fatigued, or they're just not clinically doing well. That is one of the first things that we check, as well as in an emergency situation as well, even in somebody who is not known to be a diabetic. That can be very, very important piece of the puzzle. So the ADA, the American Diabetes Association, also has a food hub, which is also very helpful. Food choices, food management, as well as just reading labels, the good old-fashioned reading labels. And so since I have um, uh, been taking care of family members for on and off for a long time, gotten much better and much uh, and thinking a lot more critically about reading labels and what that label actually tells you. And so, a label will tell you a lot in terms of the sugar content. So, basically, if it's within the first 1, 2, 3 or four of listed ingredients, that sugar content is going to be fairly, that sugar content is going to be fairly high, on those choices. And so the good news is that one, fresh fruits and vegetables are always going to be your better choice overall of healthy, or appropriate sugars versus juices and artificial snacks and those kinds of things. We also have a lot more keto friendly, types of things at our consumer disposal nowadays. So anything from keto friendly bread, which is extremely low in sugar and carbohydrates, to keto even keto friendly snacks. So again, knowing that label, knowing what to read, and more, I guess, importantly, understanding what you are reading when you're looking at a label to be able to make better choices. So those are the main kinds of recommendations and community-based approaches if that I wanted to focus on. If you do not have, and I am not a diabetic educator by background, but if you do not have a primary care physician, um, it is obviously very much recommended that you engage with somebody, a primary care provider, whether that be a doctor or a nurse practitioner, on at least a minimal of an annual basis. And like the primary care provider that I go to now, they've actually merged with a diabetic associate office. And so they're all in one now. So all of the primary care doctors now, just kind of by nature now, have an increased, focus on diabetes and diabetic management. So, I mean, anytime you can focus on a practice setting or be seen in a practice setting with that kind of management level skill is also important. So, and there are lots of things that will help. They have diabetic. I had a friend in college who was type 1. She always used to wear a diabetic emergency alert band, which I also think for people that are who have very significant diabetes, I think that is very, very important. You'll hear the term brittle a lot of times. And if you think of peanut brittle, what happens, right? When you go to break it, it cracks, it breaks very quickly. And so that person with who is a brittle diabetic is very fragile, quite fragile. And their glucose level can go from high to low quite quickly. So their range goes from very high to very low over a very short period of time. And I would say that a person with more advanced diabetes, that is going to be more likely the more brittle or fragile diabetic. So lots of things, sharing information with family members as it's needed or as can be shared to help you and support you, and let people know that this is one of the things that could potentially be going on if something does happen to you, so that they do know how to help and how to intervene, especially when engaging 911. Um, if the person is a known diabetic, then there are also glucose supplements, type aids that you can give for short-term relief. And if a person is in the hospital, there is also obviously IV dextrose, that they can titrate for dextrose being glucose, IV dextrose that they can titrate, to help keep blood sugar levels at a reasonable and manageable level. So those are overall community-based strategies and recommendations. I wanted to give a little bit of time for Q&A or just to see if there was anything else that anyone wanted to add.
Well, great. First of all, I want to say again, thank you very much for the information, Susan. Most definitely very much needed. Me personally, I can use all of that information. So I'm going to most definitely take it and help it to make my life, my lifestyle a lot, I guess, less complicated
Yes.
and, just thrive to have a healthy lifestyle, healthier.
Absolutely.
Because I've been trying, little things, but you've just mentioned a few other things that, I will most definitely be taking in consideration to help me along my journey.
And kudos for trying. I mean, that is, that goes a long way to your level of success and self-management. And,
Yes.
for anybody out there that might see this, that is trying, please do not feel like you are out of options. Please do not feel like, you are giving up, because there are things available to you to make it manageable. I said kind of at the onset, demystifying diabetes, but maybe a better title might be even living with diabetes 101. Especially with a new diagnosis, yeah, it can be very, very shocking. It can be
Yes, and
very, very
challenging. Yes.
jarring, kind of mentally as well as physically. But I think, once you accept that mindset of, trying and not giving up, you do start to see things hopefully then fall into place.
Yes, well, and you're absolutely correct, and it helps. Just been helping along the way to, even if I find myself sometimes, falling and eating that cupcake or something, I'll just say, okay, that's it. Then, I almost put myself on a punishment because when I say then you can't have any for the rest of this week. You can't eat that or even instead of eating the whole cupcake, I'm eating half or three-fourths of, not completing the
Exactly.
whole thing, just finding
Yes.
ways to cut back.
Yes.
And I'll tell myself, well, then it means you have to walk an extra 15 minutes the next time I go walking, because I tried to implement walking and hate that the weather is changing because I got to figure out something else to do.
Yeah.
But, I would get up with the birds, for the last 3-4 months and, take my 45-55 minute walk. And so, that's been helping me along the way as well. It's great, helping me to feel good,
Absolutely.
energizing, so it's really good. It is, it's really good.
And it can be, invigorating from the sense of, just giving yourself that pick me up that you
There
need,
you go. Absolutely. Yep.
midday or late in the afternoon or whatnot.
Yep.
Sometimes it's early in the morning. Balance that with what your routine is,
Yep.
with what works for you. And certainly, you mentioned portion size again. Absolutely. Maybe I have a bite of the cupcake or half of the cupcake instead of the whole thing,
Yes.
or maybe I have nuts as my snack. and maybe some, some type of whole grain or something like that with
There
my
you
meal
go.
instead of chips, or instead of, my rice or my pasta. Or there are, are alternatives to that too, you just because you are managing something like diabetes doesn't mean that you have to give that up,
Right.
unnecessarily altogether. In fact, sometimes I think that that is even counterproductive to what we're trying to do, because if you, limit everything and just cut it out, especially if it's cold turkey, then, it just becomes all that much more of a shock on your system. I feel like,
Yeah.
and then
And I find myself, it makes me feel like if I do end up having a slip up, almost like, oh gosh, what do I do now? Instead, I use it as a pick me up, and like I say, like, no, rejuvenate yourself. And I speak myself happy, think myself happy, to say, okay, just because you made one mistake does not mean that you have to give up or it's the end of the world. And
that's
I
right.
then start thinking about my future, like I want to live, so I have to make healthier choices if I want to live a longer, healthier life, and I do. As I age, I want to be that person that you see sometimes, those 80-year-olds, and they're still driving, and they some of those ladies walking around looking jazzy, and I just love it, and they encourage me. So those types of things I think about and say, okay, that's what I want for my future.
Absolutely. Absolutely. And, for, again, for people that are watching this, I understand the struggle, but, when you think not only of yourself, think of family members at the same time, think of
Yeah.
children and grandchildren, who you want to be with, who you want to,
Yes.
engage, who you want to be able to do things with.
Yes.
And so again, not self-limiting. I mean, there are ways to manage that effectively,
That's
to
it.
still be
Yeah.
able to have that time with family, and manage things to the extent that you are able to be here to do that.
There you go. Absolutely. Don't have to just give up things. You just have to make some changes, is
Yeah.
what I call myself. Yeah.
And sometimes change is incremental, right? Like,
There you
you
go.
can't go
Yeah.
from here to here
Yeah.
a lot of times overnight. It,
Yeah.
has to be incremental. So,
Yeah.
yeah, very much.
Yeah.
Baby steps that will, with incremental changes that will add up over time. And so
Yeah. That's
it
it,
becomes
Susan.
more of a habit then, versus
There you go.
a kind of a
Absolutely.
have
Yeah.
to do,
Uh-huh.
sort of chore type of thing,
Yeah.
and
That's it.
to the point where food doesn't, isn't the first thing that you think of, all the
Yeah.
time. Food
Yeah.
doesn't become the driver anymore. It becomes a
Yes.
thing.
Oh my goodness, because for years my husband would tell me, early in the morning on my way to work or something, would tell him, be asked, call, all right, what do you want for dinner? He was like, dinner? I haven't even had breakfast yet. But it was a way to help me stay on task with things because I'm a planner. But at the same time, when I realized not a whole lot of people did that.
Yeah,
And I'm just like,
yeah.
oh, okay, that's all I'm thinking about my next meal. I wake up thinking about my next meal, and I'm like, oh my God, I have to change that.
And
So
there are,
now
again, yeah, please go ahead.
I'm gonna be, no, I'm just gonna say, so now I'm being more proactive about it. Even if it does come on my mind, I'm thinking like, okay, let me have some grilled salmon, make sure I'm having my vegetable. And if I'm going to have my carb of the mashed potato, make sure that it's, the smaller portion, and make more vegetables. That's supposed to be the larger portion. So
Yes.
everything you're saying, Susan, is so phenomenal. I agree. And I
No,
thank you
I
so
appreciate
much.
that. And again, I am not a diabetic educator by background, but please, anybody that is watching this that does need some additional support, contact your primary care doctor, or reach out to a diabetic educator through your insurance company,
Yeah.
potentially. They are able to spend, 1 to 2 hour blocks of time in that position, and they have the ability to do that.
Okay.
The time built into their schedule to be able to do that, and look at support and teaching and nutritional training and education, all of those things.
That's good. Thank you so much. We really appreciate it. Any other comments, questions, concerns? Let me take a look here. I don't see anyone in the chat reaching out. So, again, I mean, unless you have anything else you want to add, before we leave, Susan. Well, Jenny, she may have a question. Go ahead, Jenny.
I do. I unfortunately ended up coming in late because I had a call run over, so I missed the
Okay.
first part. So I was just wanting to know where I can catch the first part of this, so I can, because I don't know if I have questions, because I feel like any questions I might have, she might have already answered before I got here. So I was
It's
curious
okay.
where I can watch the first half of this.
Well, we'll be up on our YouTube channel. Usually, I don't know how many days it takes to
Okay.
get up there, but
Was
within,
this
I
also
would
being shared on
just,
Facebook too?
yes, uh-huh,
Okay.
uh-huh.
So
It's
what's
on
the
the face.
Facebook group
So,
where I can get it?
actually on Aging Advantage Facebook. Absolutely. I forgot about that. Thank you. That's what we're on now. Facebook Live. So Aging Advantage, Facebook page it'll be there for at least the next 30 days. After that, it's going to be on our YouTube channel. So if you don't catch it during that time, look on the Aging Advantage YouTube page, and it'll be there as well,
Okay.
ongoing.
Cool. Good. Thank
If
you
you
so
end up
much.
having any questions, reach back out to Aging Advantage. Myself, I'm Donna Mitchell. And if you want to, if you don't know Susan personally, to be able to get in contact with her, I can always send you her information. Susan's laughing, so you guys must know each other, I'm assuming.
Yeah,
That's great.
We do. And
we do. Yes.
I sent the link out, a couple of days ago, and
Okay.
so yes, I'm hoping that folks that weren't able to join us can catch it on a replay. I know several people have asked me that as well.
Okay.
So Donna, I really appreciate the opportunity. It's been great spending time with you
Yes.
guys this
Yes.
afternoon, and to you and
Absolutely.
Lee, providing such a great service and not only format but platform, for people like myself to do this. And thank you again
Greatly
on
appreciate
behalf
it.
of my company, and we really appreciated being able to join everybody today.
Yes,
Thanks
thank you
again.
so much once again. And just a real quick, I've been saying this. You see my background look like I'm somewhere on the beach
Yep,
with my hoodie
I
on.
do.
Look, with my hoodie on. I'm getting ready for the hoodie weather, but I don't want to release that kind of weather. So I said, let me make it my background.
I don't
And
blame you.
Yeah, I
For
found it
low
immediately.
carb soup ideas, inbox me.
great. There we go. Absolutely. Appreciate you guys. Thank you so much, Jenny, for joining us. Thank you again, Susan, for
Thank
this
you
great
so
wealth of
much. I really
information.
appreciate it. And
Yes,
thank you
ma'am.
for
We
everybody
appreciate
that
you.
has joined us. And if you're going to watch this on replay, thank you again for the opportunity to share the information.
Great. You guys have a great weekend. Thank you.
You too.